We're back for your ears only. I'm Melissa Exelberth.
I'm David Alpern with this quote from the news. We're all licensed by the state to carry. We've all been trained and vetted. Why wouldn't somebody want to have that kind of a group do business with them? That was Brian Hull of the Oklahoma Open Gun Association on a new state law allowing people with gun licenses to carry their weapons openly. Proponents say exposed guns will help deter crimes. Skeptics call it unseemly and fear fatal firefights. Now this.
To be honest, in a case like this, we're not in that sort of fuzzy gray area between the two worlds. We're so clearly in the camp of drug manufacturing that the FDA could take an action today. Really, all that's needed is the will.
It was just 2 days after former Food and Drug Administration Chief Counsel Sheldon Bradshaw talked on this show last month that criminal investigators from the FDA and Justice Department began to address the continuing meningitis outbreak linked to tainted steroids from the New England Compounding Center in Massachusetts and to its sister pharmaceutical firm Ameridose, which last week recalled all its products as well. An estimated 14,000 people may have been exposed to meningitis through the contaminated NECC injections for back pain, but also used for knee, hip, shoulder, and elbow problems. More than 300 have actually been infected, and more than 24 have died.
Living in pain is never easy, but how do pain patients who are not infected and their medical specialists cope when a common pain medication itself turns problematic? What are their options and alternatives? With that perspective for your ears only, on the line now is Dr. Emmanuel Emenike, founder of the Alpha Pain Management Center in Palmdale, California. Welcome to the program, Doctor.
Thank you, David. Thanks for having me on.
First, tell us if you've ever used steroids from the NECC or other local pharmacies acting as so-called compounding centers, and if so, how you followed up on the news of the contamination.
Personally, in our practice, David, we've never used steroids from the NECC or from any compounding pharmacy. Usually these steroids are manufactured by bigger manufacturers such as Pfizer. It was a result of a shortage in steroids this time last year that people started to find alternative sources of steroids.
Why are there shortages in steroids, which are so popular, so in demand by an aging but still very active population?
There are a number of factors, David. Regulatory demands that these things be used a single vial only, and the cost issues involved that led to the national shortage.
Are your patients worried nonetheless? Are they canceling appointments, and could their untreated pain cause more serious problems going forward?
They are worried, but they're not canceling appointments per se, David. They just need someone to explain to them first that our particular organization has never in the past ordered anything from this pharmacy, and we maintain the highest levels of quality and inventory control. So once reassured, they're keeping their appointments and seeking the help that they deserve.
Are you changing their therapies in some cases, if only to ease their minds as well as their pain?
I guess everyone has to, because each patient has a customized treatment plan. And this methylprednisolone we're talking about is most frequently used for cervical epidurals. There are other options, such as triamcinolone, also known as Kenalog, which are used in place of methylprednisolone, which appears to be the only one coming from this compounding pharmacy that's affected at this point.
Not your patients, as you've noted, but I'm sure many people who've received injections of this sort are not sick, but concerned they might become ill. What signs and symptoms should they be watching out for?
They should be concerned, David, rightly so, but they should watch out for things like low-grade fevers, headaches, nuchal rigidity. And with your typical bacterial meningitis, which can have onset of symptoms within days of exposure, the problem with fungal meningitis is that symptoms may appear as late as 30 days after exposure. So the ability to relate the symptoms to the exposure through an epidural may sometimes be missing.
But given what you've just said, anybody whose treatment has happened more than 30 days ago, and if they've not developed symptoms, is probably fairly secure in not being a potential victim.
Yes.
Going back to the supply issue, the FDA has said it will ask other manufacturers to ramp up production of drugs, even allow foreign imports. How effective do you expect that to be?
I think it will be effective. One of the things that we should take away from this whole experience FDA and the Centers for Disease Control do a fantastic job of being on top of these issues. Had it not been for them, one can only imagine how far spread this would have gotten. So I think these new measures that they're putting in place to address the shortage of medications, which led to compounding pharmacies, which, by the way, are not supposed to compound and sell on that level, but supposed to compound for individual patient prescriptions. So by addressing the shortage, they'll go a long way in solving the problem.
Beyond prosecution of any criminal violations at NECC or Ameridose, how much more should the government be doing about these compounding centers, local pharmacies that widely market less expensive alternatives to major brand pharmaceuticals? Do we need new regulations or just better enforcement?
I think the regulations are there, and we need better enforcement. The regulations are proper because you're dealing with something that could be potentially harmful to a whole plethora of people, because this medication has many uses, as you rightly pointed out, not only for epidurals, but for knee injections, for joint injections, and for other applications in medicine.
What about the option of natural pain remedies? There are a lot of online suggestions I read for using garlic, oats, grapes, pineapple, apple cider vinegar, cloves, blueberries. What's your view on all that?
There are very many alternatives to epidurals, and every pain specialist realizes that we follow an algorithm of using the least invasive option first, and conservative management using medications, both natural and pharmaceutical grade, are always an option in the comprehensive management of pain.
With upcoming elections, are you surprised this case hasn't gotten more attention as regards to the role of government regulation generally versus the free market?
I am surprised, but I'm pleased that it hasn't. I personally don't think that something like this should be politicized. Although the recent Sandy issue has put this on the back burner, I don't think it's something that should be used as a political campaigning tool.
Dr. Emmanuel Emenike is the founder of Alpha Pain Management in Palmdale, California, and at alpha-pain.com.
Quote from the news, "It's not what the dog looks like, it's what the dog is doing on the front porch." That was a lawyer arguing before the U.S. Supreme Court in a case involving the use of a marijuana-sniffing dog. Another case before the court involved the constitutionality of a dog sniffing drugs in a stopped vehicle.
Next, return to New York, jazz singer Sue Rainey, for your ears only.